Good afternoon, everyone, and I'm here today with Mayor Pro Tem Dave Martin and Carol Haddock, who's the Director of Public Work, Chief Pena with the Fire Department, and Dr. Purse. The Houston Health Department today is reporting 884 new cases of COVID-19, bringing Houston's total count down to 36,985. Again, that's 884. Tragically, I am reporting today that 7 more people are been added to the number that have died from COVID-19. That will bring our total count in the city of Houston to 329 Houstonians who have now lost their lives as a result of the virus. The 7 newly reported deaths and their ages are listed on the monitors. 6 of the seven were Hispanic individuals, including one in his 40s and another in his 50s. And one of the deaths was an Asian female. So again, that's 7 more who have died as a result of COVID-19, the total count now being 329. COVID-19 continues to affect our families, friends, neighbors, and coworkers, and that's why, as a city, we are asking everyone to continue to take this virus very serious so that we can do everything we can to slow the progression of this virus in the month of July. That is our goal, to flatten and to start reducing this curve in the month of July. In order to achieve that, we're going to have to work collectively and be very intentional about putting on these masks and engaging in social distancing. The virus does not care if you're young or old, rich or poor. COVID-19 is also taking a toll on the city of Houston workforce. The number of employees with COVID who are in isolation and cannot report to work has steadily increased. 224 municipal employees, and these are employees excluding police and fire, have tested positive of COVID-19. When people are sick, recovering, or in isolation, they cannot work. That means your city services may be impacted. We are doing our best for trash pickup, with street repairs and permitting, but the services, of course, are being delayed because of what we're having to face, or our employees are having to face. To bring the point home, I want to bring up Houston Public Works Director Carol Haddock, who last week lost 2 employees in a 24-hour period to COVID-19. Carol.
Thank you, Mayor. My name is Carol Haddock. I'm the Director of Houston Public Works. This past Friday, I received word that 2 of my colleagues in Houston Public Works had succumbed to COVID-19. Both logic and statistics told me that we should have expected to lose a coworker during this pandemic. However, when those statistics become names, it's personal. Today, we mourn the loss of Natarvia Robertson and Michael Sanchez. These 2 colleagues were essential employees, reporting to work every day to support Houstonians. Houston Public Works and the City of Houston continue to provide basic services that keep Houstonians safe during this pandemic. We provide safe drinking water, and we take away your wastewater. You can wash your hands for 20 seconds because this water is available at the turn of a faucet. We make sure that your storm drain systems are working and that our streets and traffic signals are operational. We make sure that construction, whether our public infrastructure or your homes and businesses, is designed and built to keep you safe. Our colleagues in solid waste make sure that your garbage, recycling, and heavy trash is collected. In short, we are essential to keeping Houstonians safe during this pandemic, but being an essential employee comes with risks. We must leave our homes every day to provide these services. We have an increased risk of coming into contact with somebody who has COVID just because we've left our homes to serve you. Yes, we have adjusted the way that we do business on a daily basis during this pandemic. We have allowed telecommuting where we can. However, for around 3,000 of our 4,000 employees, telecommuting just is not an option. It's not possible to run a treatment plant from your home office, or to unclog a stormwater drain pipe from your living room, or to repair a broken water main if you aren't physically there to repair the pipe. And since we must come in, we have done many things in our operations. We've staggered our reporting times. We take temperatures of every person entering one of our facilities. We require that everyone wears a mask. We send extra vehicles to job sites so that we don't have more than 2 people riding in a truck. We provide hand sanitizer and have installed plexiglass shields. We've taken over conference rooms for offices and to serve as break rooms so people can be physically distanced. We've arranged for field crews to go to neighborhood police or fire stations for restrooms and for access to water, since most of the places we normally use aren't available today. Yet even with these measures, more than 5% of our team is out of the office today, either having tested positive for COVID, waiting for test results, or in quarantine because of an exposure. This means that it will take us a little longer to repair that water main break or to clear that ditch or to process that permit. Friday, we lost 2 colleagues. They were essential employees providing essential service to Houstonians. But they were more than that. Natarvia Robertson will be greatly missed by her family and her extended family. Michael Sanchez was a husband, a father, a brother, and a son. And the family of Michael Sanchez wants Houstonians to know of his passion for serving this city. The entire Houston Public Works family asks that you lift up both of these families and our entire department during this time. And I want each of you to know that the men and women of Houston Public Works will continue to show up every single day to make sure that we are providing those essential services to Houstonians. And next time you turn on your faucet and safe drinking water comes out, think of our city employees out there providing essential services and say a quick thank you. But even more important than thanking us, help keep us safe by not going out when you don't need to. And if you do have to go out, make sure that you're wearing your mask. Thank you.
Let me thank Director Haddock, and please bear in mind that these are essential employees. These are the people, for example, that are making sure that while you're at home or in your business, when you turn on the water is coming on. These are the people, for example, who engage in our street rehabilitation program. These are the people who are picking up your trash. They are essential workers. They cannot work remotely from home. And quite frankly, even when their colleagues are coming down with the virus and others are having to quarantine, these are the employees that continue to be on the front line. So I would ask that please be understanding if there are some delays that are taking place in the city. The city employees are not immune to what is occurring out in the community, and it provides an added reason why it's important for people to put on their masks and to engage in social distancing. Let me bring up Chief Pena with the Houston Fire Department to talk about what's happening in his department. Chief Pena.
Thank you, Mayor. First of all, I'd like to express my condolences to the 2 Public Works employees who succumbed to this virus. We also have a firefighter that's in intensive care right now. Captain Lucio is in intensive care in a hospital in San Antonio, continuing to fight for his life. He is in critical condition. We ask that this community, again, keep lifting Captain Lucio and his family up in their prayers because they are going through a very difficult moment at this time. In regard to our personnel in quarantine, today we have 162 firefighters that are in quarantine. Of those, 38 are positive for coronavirus. In the extent of this operation, we've had 189 firefighters who have contracted coronavirus. 151 of those are back at work, so we still have 38 that are positive. We maintain, in the last 24 hours in regards to our occupancy task force, we've responded to 48 complaints for perceived violations of the governor's order, and we're able to mitigate each one of those incidents on the spot. So again, a credit to our inspectors and a credit to the business community for the work that they're doing. I would like to take this time to clarify some misinformation that's floating around on social media in regards to the status of the fire stations. There are no fire stations that have been closed. Regardless of what's been put out on social media, all fire stations remain open. Again, today we have 162 firefighters in quarantine and another 48 that are off on some other leave. Very difficult to staff when you have that many people sidelined. But we're doing everything we can to ensure that the units, every unit that we have available is staffed, okay? Thanks to the firefighters and the hard work that they're doing. Thank them for pulling the extra duty. But we are staffing 100% of our ambulances. We're staffing 100% of our fire engines. And at no point have we fallen below 90% staffing of our aerial apparatus. Okay? So I want to clarify that and make it perfectly clear that there are no fire stations that have been closed, because I know that there's been some misinformation being circulated on social media, and that is furthest from the truth. We are being challenged regarding staffing. Every department in the city is. Our employees are out there. We're being impacted by this community spread of the virus. As the mayor mentioned, we are not immune to the virus as well, so it does impact personnel. But we are doing everything we can with the resources that we have available to ensure that we're providing the service and that we're there for the community when they need us. Okay? That's my report. Thank you.
Thank you, Chief. I want to thank our firefighters, want to thank our municipal workers, and want to thank our police officers. And one of the reasons why we hold these press conferences on a regular basis to make sure you get correct information, because that's critically important when we are dealing with a pandemic. Misinformation doesn't serve anyone's purpose. Over the weekend, Houston lost one of our prominent citizens and restaurant owners, Vincent Bubba Mandola, who died on Sunday, July the 19th, due to complications with heart failure. His family tells me that he did contract COVID-19 in June. However, he passed away from heart failure. We certainly want to remember Vincent. For many of us who've been to at least one of the several restaurants, we know what a business person, family he comes from, and Vincent will always be remembered. And so we want to take this moment to pause on behalf and to remember Vincent Bubba Mandola will be deeply missed, and to his family, we want to continue to lift them up in our thoughts and prayers. And now at this point, let me bring on Dr. Peirce.
Thank you, Mayor. Dr. Haddock, sympathies to your entire department as well as the families of those who passed. We've been talking about how the virus is spreading. We have some data we've been showing, trying to keep the public up to date. And this graph shows the positivity rate. So again, this is the percent of tests that are done, and of those tests, how many are coming back positive. And you'll see we are remaining to hover. Looks like it's a little bit of a downtrend, but that's actually less than a 1% downtrend, from 25 to 24+%. The yellow bars are the number of tests are done. The red are the number that came back positive. And the number is very high. So it is too early to suggest that, that this is really a flattening of the curve, although I can see where some people would say that. I'm just a little bit too cautious to say that just yet, because the virus continues to spread. Now, everything that we do as Houstonians to wear masks and to keep ourselves separate from others helps. So that may be what we're seeing here, but I'm just going to wait a little bit before I say anything more definitive. In our next slide, similar to what we've shown in the past, by zip code are those neighborhoods that have got the higher rates. And on this map, the darker the blue, the higher the rate within that zip code. And you see for those that are the darkest, it's more than 30%. That's a very high rate. Now, if you remember the slide that we showed last time, about a week ago, it was slightly different. And the colors were the same, the legend was the same, but the zip codes were different. And I said back then that this is an evolving, this is like taking a single frame out of a movie, that the colors will shift across the community as the virus spreads across the community. So those are the zip codes that today have got the highest, and they are actually not terribly far from where they were last week, but they will continue to move. Nevertheless, the virus, there's and those that are lightly colored does not mean that there's no virus there. All right? So don't be, because the white, the lightest color, is just down to 20%. So that's still 1 out of 5. So there's still a lot of virus in the community. So read the chart, this map, for what it really says. And what it shows is that there is lots of virus spread throughout our community, and some zip codes are just a little bit hotter than others. All of this is preventable by wearing a mask. Don't go to large gatherings. Don't hold large gatherings. Stay 6 feet away. Wash your hands. Thank you.
And the point I want to make is, and I'll get ready to take questions or comments from anyone, is that this month I'm asking people to be very intentional, very focused about putting on these masks. Please, that's one of the things I want to emphasize, that city employees, that are people that are outside of our city, that's where, regardless of where you're going, if you're going to some sort of event or meeting or wherever it may be, I'm asking people to please, if you're in the presence of someone else outside of your home, please put on your mask. And quite frankly, if you're in your home and there are people coming in and out of your home where you don't know where they have been, I'm going to ask that you put on your mask. I'm going to ask that you engage in social distancing and make sure that you're washing your hands or using sanitizer. Let's be very intentional for this month. And if we work together, I think this month or over the next week or two, we ought to, hopefully we'll see positive results, and not only flattening, but hopefully the number will start to come down. And again, the goal for us is to reduce the number of people going to our hospitals, reduce the number of people needing ICUs, ventilators, you name it, such that our healthcare delivery system is not overwhelmed. So that's our goal, regardless of somebody, whether or not there is a shutdown, no shutdown. I am asking Houstonians to take it upon themselves to do what they know we need to do collectively in order to win this battle against COVID-19.